Patients who are diagnosed with COVID-19 have a new treatment option available that may help keep them out of the hospital. The Wright Center for Community Health is offering the outpatient infusion clinic. Julie Sidoni has more in tonight's Healthwatch 16 report.
The Wright Center for Community Health in Scranton is offering a new outpatient infusion option to treat some patients with COVID-19. Monoclonal antibodies found in the treatment are lab-created proteins that aim to target and neutralize the virus.
Because these are the antibodies that prevent the virus from sticking to certain receptors in our body, into the cell. And hence they prevent the cascade or inflammation that occurs as a result of those viruses attaching to our body cells.
Dr. Jignesh Sheth is Chief Medical Officer of Wright Center for Community Health. He says the infusion is through an IV and typically takes about an hour. As of last week, he says the Wright Center had done 43 infusions.
Nobody landed in the hospital. So 0 hospitalization from all the 43 patients who got it. And 55% of my patients were above the age of 75. Age plays a big role. If we are able to give them the antibody, it's a lifesaver for them. None of them ended up in the hospital.
To be considered for the treatment, you must be at least 12 years old. You must have tested positive for COVID-19 using a PCR nasal swab test. You must not be hospitalized or require oxygen for your symptoms. And you must either be 65 or older or have underlying medical conditions considered high risk for developing COVID complications. Dr. Sheth points out you do not need to be symptomatic, and you don't need to be a Wright Center patient. Referrals are welcome from community physicians. He says so far the results have been promising.
Some of them were like almost 99% better in a day, and majority of them were better at 3-day mark after the infusion.
For questions or more information about COVID-19 infusion therapy, head to our website, WNEP.com. Julie Sidoni, Newswatch 16, Scranton.